Hi, I'm Dr. John Young here at Foundational Health Center here in Largo, Florida. And we're starting a two-part series. Part one today is on Parkinson's disease. Parkinson's disease is the number 2 neurological disorder in the world. Alzheimer's dementia number 1, Parkinson's number 2. It's characterized by what a lot of people realize is the tremors. You see people with kind of like they're rolling pills in their fingers. You'll see a shuffling gait. You see constipation, slow cognition. Their brain's a little bit slow in working. You see that if they get going in one direction, it's hard to stop and turn. And as it gets worse and worse, you just see a lot of hallucinations and just slowing down of the body. The average diagnosis, from diagnosis to death, is from 7 to 15 years. There is no blood test. You can look at some brain scans, but it's really looking at the physical signs and symptoms of what the patient's talking about. Now, the causes, there may be some genetic causes. There may be environmental. If you're around a lot of pesticides or petroleum products, those type of pollutants do seem to cause injury to the brain stem where the substantia nigra is. And it's that area of the brain that produces dopamine. So when the dopamine cells are dying, you start to see signs of Parkinson's. And what they do is they give you forms of dopamine. And it's really great because a lot of the signs and symptoms of Parkinson's go away. But what we're finding is when you take dopamine, it may be a 100 milligram pill, you absorb 1% of it because it's so hard to get that pill, that dopamine, from the intestines across the blood-brain barrier into the substantia nigra at the back of the brain. So you may start out at 1 tablet a day, 2, and I had a guy the other day takes his dopamine tablets every hour and a half just to keep moving. He becomes so rigid that he'll be walking and all of a sudden freeze and can't move at all. So what the bad news is that it is a progressive disease and it ends in death. In the next part, we're going to be talking about there is great news in treating Parkinson's, and you can get better.